Chapter 17, Exercise and Psychological Well-Being. Physical fitness is positively associated with mental health and well-being, and also long-term exercise is usually associated with reductions in traits such as neuroticism and anxiety. Appropriate exercise results in reduction of various stress indicators, including neuromuscular tension, resting heart rate, and stress hormones. So why choose exercise for our psychological well-being? Unfortunately, we cannot avoid stress. Stress is a part of our daily lives. Technology has been developed to make our lives easier. However, it has made the world exceedingly complex and increasingly pressured. Americans in particular are working longer hours and are exercising less and less, and our health is seeing the ill effects of being sedentary. Exercise can positively influence feelings of well-being. Exercise can help reduce anxiety and depression, enhance mood, improve self-concept, and improve the quality of life. Additionally, exercise can result in increased feelings of vigor. Some people have suggested that exercise is the most powerful pill that can be utilized to help increase health and well-being. The President's Council on Physical Fitness and Sport has said, if exercise could be packed into a pill, it would be the single most widely prescribed and beneficial medicine in the nation. Exercise is a wonderful treatment for those living with pain or chronic conditions that is hugely underexploited. Exercise reduces blood pressure, weight, and diabetes. If exercise was a pill, you'd be taking one pill to treat 4 or 5 different conditions. According to the Center for Disease Control, or the CDC, well-being is a positive outcome that is meaningful for people and for many sectors of society, because it tells us that people perceive their lives are going well. Good living conditions, such as housing and employment, are fundamental to well-being. Tracking these conditions is important to public policy. However, many indicators that measure living conditions fail to measure what people think and feel about their lives, such as the quality of their relationships, their positive emotions and resilience, the realization of their potential, or their overall satisfaction with life, such as their well-being. Well-being generally includes the global judgment of life satisfaction and feelings ranging from depression to joy. Feelings of well-being include self-acceptance, which is a positive view of one's self, positive relations with others, including feelings of trusting, caring, and empathetic relationships, autonomy, which is a self-determined feeling characterized by intrinsic motivation and self-reference standards, environmental mastery, which is effective mastery of the environment to fulfill personal values, personal growth, or the sense of development and sense of fulfillment over time, and purpose in life, which is directed towards purposeful goals for living. Mental health issues account for approximately 30% of all hospitalizations in the United States. Anxiety and depression are 2 of the mental health issues that have received the most attention. So far, most studies of the relationship between exercise and the reduction of anxiety and depression have been correlational, meaning that there is a cause and effect relationship. So it is difficult to conclusively state that exercise caused or produced a change in an anxiety or depressed state. Exercise appears to be associated with positive changes in mood states and reduction in anxiety and depression. Aerobic exercise has been demonstrated to work the best, but other forms of exercise are quite effective as well. Regular exercise can make a significant impact on people's overall health and well-being. There is a large body of literature which supports the position that regular exercise leads to improved psychological effect. This research indicates that regular exercise reduced negative effect and also increased positive affect of well-being. Resistance, aerobic, and cross-training exercise modes are associated with beneficial psychological effects. Exercise and the reduction of anxiety. There are acute effects which are essentially short-term effects. Aerobic training results in consistent reductions in somatic state anxiety. The positive benefit may not be just due to the exercise itself. Exercising at a level of at least 70% of your maximum heart rate shows the greatest reductions in post-exercise state anxiety. The chronic effects are long-term effects. These usually last around 12 months. The reduction in state anxiety may last many weeks after exercise ceases. The principle of more is always better does not necessarily apply to exercise. Greater physiological gain does not necessarily result in greater psychological gain. Regular exercise is known to increase cognitive function. Cognitive function can be defined as cerebral activities that lead to knowledge, including all means and mechanisms of acquiring information. Cognitive function encompasses reasoning, memory, attention, and language, and leads directly to the attainment of information, and thus knowledge. Cognitive function should not be confused with IQ. They are not the same thing. So what does the current research report? Moderate to intense aerobic exercise is effective in promoting well-being. Some research shows an individual's preferred intensity is best. If participants are not allowed to choose their own intensity, boredom or dropout was more common, thus defeating the purpose of engaging in exercise. Acute bouts of exercise are not usually immediately effective in increasing feelings of well-being. There is a delay of 30 to 90 minutes that have been shown. The delayed anxiolytic effect is the phenomenon that beneficial reduction in anxiety does not manifest itself until sometime following an acute bout of exercise. State anxiety can reduce for up to 24 hours following exercise. Let's talk about the circumplex model of effect. This is not in your textbook. We either have a high level of arousal or a low level of arousal. Exercise can either be considered unpleasant or pleasant. If exercise has a high arousal but is unpleasant, it will result in negative affect for the individual. If exercise has a high arousal but is pleasant, it will result in a positive affect for the individual. If exercise has a low arousal and is unpleasant, it will have a negative effect for the individual. And if exercise has a low arousal but is pleasant, it will have a positive effect for the individual. To help explain this model more, the description of the exercise-induced mood changes according to the circumplex model of effect appear to be relevant for two reasons. First, data indicates that there may be movement along the dimensions both during and following exercise. Likewise, exercise produces significant changes in activation. The circumplex model of affect seems particularly well suited to the study of exercise and mood because exercise may induce changes in both dimensions of the model. The horizontal dimension represents affective valence, pleasure or displeasure, and the vertical dimension represents perceived activation. The affective space is divided into the four quadrants. Exercise is now a recognized intervention for clinically depressed people. All modes of exercise are effective, but exercise with greater duration provides greater antidepressant effects. The intensity of the exercise is not related to changes in depression, however. For many years, researchers have been examining the effects of exercise on well-being. Fox, in 1999, suggested that exercise is related to the participant's self-concept, self-esteem, and self-efficacy. Gruber, in 1976, yes, this was a long time ago, we've known this for at least this long, suggested that positive changes in self-concept and self-esteem were associated with participation in physical education and directed play. Exercise has been studied across many populations, including children and the elderly. We'll start first with children. The attitudes regarding exercise are greatly influenced by parents. And next, the elderly. Profound positive effects are noted with exercise, both physiologically and psychologically. Individuals who suffer from disabilities can also benefit from exercise. Exercise has been documented to psychologically benefit across all disabilities. Other special populations have been examined as well. In individuals with the human immunodeficiency virus, or HIV, exercise is associated with an enhanced quality of life. In individuals with multiple sclerosis, exercise is associated with greater energy, vigor, social, and sexual functioning. And in individuals with cancer, exercise is associated with greater quality of life. Some individuals have examined the more global question on how exercise affects our quality of life. Quality of life has been defined as an individual's perception of their position in life in the context of culture and value system in which they live in relation to their goals, expectations, standards, and concerns. In the workplace, quality of life is associated with feelings of life satisfaction, job satisfaction, and self-worth. Regular exercise is associated with better health, stamina, attitudes towards work, coping, total sleep time, and even quality of life, especially for students in the college population. In our older adults, exercise is associated with greater life satisfaction, less dependence on others, and better physical health. Exercise contributes to the quality of life by influencing affect, perceived stress, health, and satisfaction. Some people wonder how to increase their exercise frequency or how to maintain their routine. Some moderating variables include the time of day. There is not a perfect or best time of the day to maximize the psychological benefits associated with exercise. Exercisers should really focus on when they are motivated and when they have time available. Being consistent in their exercise routine is more important than the time of day that we're exercising. Music can also have an impact on exercise. Music can increase the positive affect of the individual, and it can also decrease the perceived exhaustion of the individual while they're exercising. We can also examine attentional strategies during exercise. One method is external dissociation or focusing. This can increase the psychological benefit of participating in exercise. External dissociation or focusing acts as a distraction. Another method is internal dissociation or focusing. This can increase anxiety for the participant, as too much focus on the self or work can cause people to judge themselves or get lost in the details of the exercise, and thus results in an increase in anxiety. So how or why does exercise do what it does for mental health and well-being? There are physiological results from a regular exercise program. We see an increase in cerebral blood flow, changes in neurotransmitters such as norepinephrine, endorphins, and serotonin levels, increased oxygen consumption and delivery of oxygen to cerebral tissues, decreased muscle tension, structural changes in the brain, and increased serum concentration of endocannabinoid receptors. Cannabinoid receptors are located throughout the body and are involved in a variety of physiological processes, including appetite, pain sensation, mood, and memory. There are also psychological changes that occur with regular exercise, including increasing feeling of control, feelings of competence and self-efficacy, positive social interactions, increases in self-confidence and self-esteem, and opportunities for fun and enjoyment. There are several theories that try to explain why exercise works on a psychological level. The cognitive behavioral theory. It encourages and generates positive thoughts and feelings and counteracts negative mood states. The social interaction hypothesis suggests that associations with friends and colleagues are pleasurable and therefore has a net effect of improving mental health. The distraction hypothesis suggests that exercise affords an opportunity to be distracted from worries and frustrations, whereas the cardiovascular fitness hypothesis proposes that improved mood state is associated with improved cardiovascular fitness. Other explanations have suggested that the changes are more chemical in nature, like the amine hypothesis and the endorphin hypothesis. The biogenic amine hypothesis states that depression is caused by a deficiency of monoamines, particularly noradrenaline and serotonin. According to this hypothesis, depression can be alleviated by drugs that increase the availability of noradrenaline and serotonin. The endorphin hypothesis suggests that exercise promotes psychological well-being by increasing the secretion of endorphins, which reduces the sensation of pain and produces a state of euphoria. This is more or less an explanation of the feeling better through chemical changes model. Exercise in special populations. When examining exercise in clinically treated patients, especially depressed populations, we see greater psychological benefits than for healthy populations. This includes participating in both aerobic and anaerobic exercises, and the results were best if the exercise regimen was a long-term commitment and participation. Some studies have shown that exercise is just as beneficial as a treatment compared to some forms of psychotherapy and drug therapy.